For folks on Medicare, in October, well, they're going to have a lot on their plates. It is the precipice of one of the busiest times of the year for Medicare folks because of the annual election period for Medicare. Also, the weather is changing, pumpkin lattes come back out, and so does the announcement of the new cost of living adjustment, or COLA, for seniors, for retirees, and for older Americans. Now, this is so important because it will give folks an idea of what their actual budget will be for the year to come. And depending on how much it does go up, that COLA that is, it could mean that their Medicare costs also start to take up a bigger or potentially smaller portion of their Social Security incomes. So today we're going to be talking about the 5 things for the 2025 Social Security yearly COLA adjustment and how it will affect folks on Medicare and what they can do to help cover some of those increased costs. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. Starting off today, let's talk about the COLA and how it relates to Medicare, because it really, truly does. But a lot of people don't think about it. They just sort of feel it in their pocketbooks, but don't realize it has a correlation to their Medicare. Because realistically, Social Security benefits is one of the main ways that people pay for their Medicare benefits and also their daily lives, as those benefits get adjusted by the COLA, which is a percentage of change that happens every single year. And it'll affect how much of their overall budget gets eaten up by healthcare costs, primarily Medicare, depending on the Medicare increase that also happens. And it can also have a pretty heavy effect on somebody's finances if the COLA goes up at a much slower rate than their healthcare costs. This is doubly true for seniors who tend to have higher healthcare costs and lower income increases, as many folks have their Social Security benefits as one of the largest or maybe even the only source of income that they have. So yeah, it all ends up affecting each other, and how that COLA change can make a big difference in someone's yearly income and their yearly life. And that being said, let's get to the COLA increase for 2025, which just came out, and it's going to be set at 2.5%. Currently, in August of 2024, the average Social Security benefit for a retired person in the United States is at $1,836 and a couple of cents. This means that with a 2.5% increase, the average American will see a $46 increase in their Social Security benefits, putting it at, on average, at $1,881 per month and some cents. This amount is going to be way, way, way lower than it was last year, which was at 3.2% increase. I mean, and even in 2022, it was a whopping 8.7% increase, really for the main reason, apparently and allegedly, because inflation is falling in the United States, and it usually, suspiciously does, just happen to happen during the fall when the COLA test period seems to be happening. So those 3 months of July, August, and September. Just seems to happen that way. But with inflation going down, allegedly, it means in theory that seniors don't need a big adjustment for their Social Security benefits to keep up with the cost of living, right? Now, I want to point out here, there are a lot of reasons why the way that the COLA is calculated is not really the best metric for seniors, and primarily because it doesn't really accurately account for the costs that seniors have, including things like healthcare. And this is even doubly agreed upon by the good folks at the Senior Citizen League of America. But unfortunately, it is what it is, and it is what we got, and it is still better than nothing. So let's talk about how those things two correlate. All that being said, let's apply the new COLA to the potential cost for Medicare in 2025. Now, we don't know exactly what the cost for Medicare, the Medicare Part B premium to be exact, in 2025 is going to be because it hasn't come out yet. But the smart money is saying that it'll probably be around $185 a month, which is up from 2024 where it was set at $174. This is an estimated increase of $10.60 or about a 6% increase. When we compare that to the COLA increase of 2.5%, the actual average dollar amount of that comes out to $46. And we can see that if the Part B premium goes up to $185, then it will start to eat up 23% of the average Social Security benefit increase, which is way, way less from where it was in 2024. Also, keep in mind that $46 is the average dollar increase, but it turns out that almost nobody is specifically average, and that $46 is comprised of a few beneficiaries who have very high Social Security benefits, and then the vast majority of beneficiaries who have much, much lower benefits averaging out. So for them, a $10.60 increase has a much bigger effect on their personal finance than the few folks who have much higher Social Security benefits. Ultimately, what this means is that there is less money going to be in seniors' pockets on average for their health care, but also to pay for things like rent, to pay for things like utilities, and to pay for all those true, real, in real life and in real dollars cost of living. Another reason why the COLA is so inaccurate for helping seniors adjust to their specific cost of living is because of the way that it's calculated. Because it is based off the average cost the average urban dwelling clerical worker in America has. But seniors actually have costs in specific areas, again, like healthcare, that are much, much higher as they utilize healthcare services at a much higher rate. So when the standard COLA is calculated, it doesn't weigh these services accordingly, and seniors sort of get shorthanded as a result. As an interesting hypothetical, there is an actual way the COLA could be based off of the same metric it is right now for the average American CPI, but it could be replaced with a metric of a cost specifically for seniors, creatively called the CPIE, or the Consumer Price Index for the elderly, which does a much better job of, accounting for additional costs that seniors have than, the naming conventions of it, but economists, right? In fact, if the CPIE was used to calculate the COLA, it would show that seniors would need to get a 3% increase in their Social Security benefits, putting the average benefit at $1,891 after a $55 increase based off the CPIE. This would be in order to keep up with those costs of living. That would also mean that the $185 estimated Part B premium, that's for Medicare, would only take up 18% of the average Social Security check increase, leaving at least some more additional money in seniors' pockets for, again, those other daily costs. Also, bear in mind, each year the percent increase is based off the previous year. So a few dollars more now means a continually larger increase even further down the road as those percentages keep getting based off the previous dollar amounts. So after all of that, what can be done in the real, non-hypothetical world of 2025? Well, there are a variety of benefits on Medicare plans that can help alleviate the discrepancy between the Social Security benefits increase and the cost of healthcare, the Medicare increase. The most notable and obvious is the Part B reimbursement that pays for usually a portion, if not most, of the Part B cost, depending on the plan that someone gets. But I think the highest one that I've seen, at least here in Southern California, is $150 a month, which is available in both Los Angeles and San Diego in 2025. So I mean, that one is pretty obvious, but realistically, plans have allowances for things that Medicare beneficiaries spend money on otherwise. So things like dental or hearing or over-the-counter benefits. If they can get those things paid for by the Medicare Advantage plans, it is going to be more money left in their pockets for things that they were going to buy anyways or would need to buy anyways. That can help make up for some, of that sizable increased cost. Lastly, there are things like the Low Income Subsidy Program, or LIS, that helps pay for some or almost all of the cost of medications for those folks who qualify, or even the new cap on drug costs put in place under the Inflation Reduction Act. That will mean that some seniors' prescription costs will not go as high as they have in previous years, because they can't, because there's a cap, which will likely also put some money back into those specific Medicare beneficiaries' pockets. So overall, looking at the COLA for 2025, it has followed the pattern of not really truly accounting for the costs that seniors have to ensure that they are guaranteed that quality of life that they were promised while they were working and paying into the Social Security system while they were working all those years. But also, not to mention, we're paying into it as well. But it is much better than really a lot of the other alternatives out there. And there is some alleviation that could be had in situations where it makes sense if someone chooses a plan that is going to be more designed to provide financial value to a senior's budget and maybe at the expense of some of the healthcare. But those are choices to be made with a professional. All right, so that's it for today's Michael's Medicare. And if you or somebody you know has questions about their Medicare plan, this AEP, or really all year round, please feel free to reach out to us at the information down below, and we'd be happy to assist them over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe so you can get updates when our newest great Medicare content comes out every single week and doubled up during AP. So, for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.